Well, Gibby is with some heart experts right now to tell us more about that procedure.
Yeah, good morning, Javier. Here's the thing, everyone excited to see the Stones. I bet first, when they first heard that Mick Jagger was having problems, they were questioning whether they're going to be able to see him here in the Valley. Well, tonight is the night, and we want to go over that procedure. I have the director here at Abrazo. It's Dr. Neil Klein. Here's the thing. First, it used to be an open heart surgery when you guys used to do this type of a of TAVR, but you guys have switched it all up, and the time now, you said 1 or 2 days as opposed to 8 to 10?
That's correct. Previously, the treatment for aortic stenosis, which is what this procedure is for, required an open heart procedure. Patients typically would be in the hospital 8 to 10 days. There would be a rehab period. Patients would be very uncomfortable because of the sternal incision. There are a lot of pulmonary complications, risk of infection. Now we have an alternative to the open procedure, which is called TAVR, transaortic valve replacement. So this procedure replaces the valve without the need for opening the chest, and the procedure is accomplished by putting a balloon through an artery in the leg across the heart valve, and then ballooning open the valve because the valve's stuck, it's stenotic, and then placing this device over another balloon, which expands the valve and replaces the damaged valve with a brand new valve. This patient would only be in the hospital 1 or 2 nights and resume pretty normal type activities within a week to 10 days. What we're here to talk about, though, is what's the value after surgery. We still call this a surgical procedure, but it's not an open procedure in cardiac rehab.
Now, here's the thing with aortic stenosis, as you mentioned, and not getting into personal names, I'm just saying, let's say somebody in their 70s and they want to do all this exercise, like let's say dance on stage and sing, and to get them up to that value, that can all be done because that's where you get up to, right?
That's right. Patients who end up needing this procedure are usually very symptomatic. They have lost their energy, their muscle strength is decreasing, their flexibility is leaving them, and they become very sedentary and have lost a lot of strength. The value of cardiac rehab for these people is to get them back very quickly, improve their muscle strength, improve their flexibility, improve their energy levels under a supervised, controlled environment.
And that's what you guys do here. You guys offer that for your patients who go through this type of procedure, and that's what they're going to have me do. They're going to have me go through the motions here. They're going to get me all loaded up in here, but you're going to be standing by, right? I'll feel more comfortable if you're standing by. That way, in just case I pass out.
Yeah, we'll be here for you, no problem.
Because I don't think I have moves like Jagger.
I think you're right.
So yeah, see, I don't move like Jagger. Doctor got to see him in '69. My boy, I just going tonight. Here's the thing. I think I have to sign something first before I have to get on any kind of heavy equipment. I will be heavy breathing. You ever hear when you think about it and like that procedure gets you, like my heart's already tightening up and I haven't even jumped on any of these machines here, man.
Nerves, brother, nerves. You'll do well, And I've seen you out on the dance floor. You do got moves like Jagger. You're all right.
I could do the Humpty dance, and I don't know if I could do the Jagger. I don't know.
That's all right. Elbows up, side to side. It counts. Thanks, Gib.
So how did this surgery and rehab save the Rolling Stones tour?
Well, Gibby is live at Abrazo Arizona Heart Hospital, and he is showing us how this rehab works. Gibby, good morning.
Ladies, good morning. Here's the thing, I usually just play one on TV, right? But we're actually going through this because we want to get a correct reading when it comes to this, and who better to kind of help me out with that here at Abrazo Arizona Heart Hospital than Jennifer Lyons, who is the exercise physiologist. Did I get that right?
Yeah.
Okay. So first we were walking, we got the heart rate pumping a bit. You kind of got my measurements ahead of time. The reason why we're doing this, when we talk about aortic stenosis, that's half the battle. You have the surgery, it's a lot better than it used to be, but Mick Jagger on YouTube was dancing and getting ready 6 weeks later. How is that possible?
Well, the purpose of cardiac rehab is to get patients back to their normal exercise capacity. So here we can be as conservative or as liberal as the patient needs, and we have lots of different pieces of equipment to be able to get them up to that level quickly.
And I think that's the key. I think one of the things is getting educated on whatever it is they're doing, because I was telling you that when I had back surgery, one of the scary parts was not knowing what my limits were. And after a heart surgery or a heart procedure in this case, you have to know what your limits are or where you think you can go, and that's where you kind of work with them.
Yeah, we measure patients' heart rate, their blood pressure, and we also monitor their heart rhythm to make sure they understand what's going on while they're exercising. And we teach them what are safe limits for them to do on their own and how to feel when they're at those limits.
And here's the deal. You're having to deal with all types. As you were just telling me, there was a jogger that would go on that treadmill at level 14, where I was at a level 5. Or you had somebody who, let's say they walk every day, but yet they've never ridden a bike. For someone who would have to perform, let's say, on a day in, day out basis as part of their job as an entertainer, is that how you would kind of fix their therapy before they go out and about?
Yeah, we want to make sure that when they're at the levels that they want to be, that their heart rate and blood pressure are good and that their medications are adjusted. And that's a nice thing. We can talk back and forth with the doctors and make sure that the patient is at their best ability.
What's the hardest thing to get across? Because I know a lot of times, as I mentioned, you'll probably tell them, hey, I need you to walk. But if they don't come to a therapy where you're right here next to them, making sure they're not cheating or taking corners, I think that's the biggest key.
Yeah. Exercise is a lifetime thing. Patients come in and they're scared and they want to learn what's appropriate to do, and they have a schedule and they just do it. But when they're on their own, it gets really easy to slack off. So our goal is to make sure that they know that exercise is a lifetime thing. It's not something you just do during recovery.
All right, ladies, when we come back, we'll see if I can get the satisfaction that I need, because they definitely started me up. Show them the little monitor right there that you see there. We'll see if that is good or bad, because as it's going up and down, the only thing I can tell you is I'm alive. Barely.
You're alive.
But I'm alive.
We know you are,
And I
Gib.
can still breathe.
You're breaking a sweat, Gib. You got this.
Piece of cake. He's got it. Go, 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 go. Thank you, Gibby.
Well, last hour, Gibby was hooked up to a monitor to show us how a cardiologist are helping heart patients get better in a new way of cardiac rehab.
Yeah, and we all know Gibby already has a big heart, right? So how strong is it? I guess that's a question. Let's check in with Gibby this morning. He is at Abrazo, Arizona Heart Hospital. You made it. You made it.
I did. Well, I'm still breathing, and as you can see, you know, I don't know if earlier they picked up all the references when I said, you know, if you've had your heart shattered and you're still looking for satisfaction, then you should know that it shouldn't be a beast of burden if you have to have therapy after a procedure like this. Jennifer Lyons, who is the lead physiologist here, exercise physiologist, we were talking about this procedure that was done and how it's evolved, because before it used to take about 7 to 10 days, open heart surgery, people would be in pain. Now it's invasive. You have it 2 to 3 days later. They don't get to really go home, but they get to come see you, which is the more exciting part, because in order to get this working the way you want to get your stamina up, to be able to be an active person, an everyday person, therapy plays a huge role.
It does. It plays a huge role. We spend so much time educating the patients and letting them know like how their heart works, understanding their procedure, understanding how their meds work. It helps with long-term compliance.
That's basically what we saw with me. You didn't put me through the ringer. You did you took it easy on me, but here I was. This is what a typical person would come in. One of your patients would come in, you either have them on the treadmill and they're working. They're getting that heart rate up. And What is that telling you?
Well, it tells us how they're responding. So we start them out easy and then work them up as they progress and make sure that they feel comfortable and have a good long-term understanding of how to progress their own workloads.
Yeah, the other thing, too, when we take a look at these, you had mentioned to me whether there's a guy who is an avid hiker or a jogger, their levels are going to be working out a lot higher, so you're going to be able to push them. That brings me to a point of a 70-year-old entertainer who has to perform on a nightly basis. What gets them to that point? And you said a lot of it determines on what their health was like before they started.
Yeah. Their health before they start plays a huge role. It helps them recover faster from procedures, and it helps us be able to have the ability to push them harder. We love it when we get patients like that in here because we can really push them and show them what they're capable of doing.
All right, now for the true test here. I was monitored up as they saw a video of you putting this on me here. What did it record? Is my heart strong enough to withstand getting joked upon? Because wait, hold on. Is my heart strong enough to take whatever you're going to tell me here? Just let me know.
Yeah.
Okay. What did you see here? What did we see after the first?
So when we look at your heart, we get two different views, and we can see how it's responding at rest and how it compares to what you do at exercise, and then how fast it comes back down to resting levels afterwards. The faster you come back down afterwards, the better it is in terms of showing how good, what kind of shape you're in.
All right. So basically what she's trying to tell me, guys, is that if I wanted to, wait, can I get a note to the fit shop? Because I needed you to tell them that I already did my cardio for the day. And she kind of said that's a definite no. So she basically said I could just keep going on.
Like
See?
Jagger.
Yeah.
He's got the moves like Jagger.
Look at you go.
ahead.
We're just going to
Go
watch
give.
this all day.
Go
Oh, you
give.
got the footwork
Oh,
too.
there you go. All right, not too much. Not
Yeah,
too much.
we want you to come back.
Save the heart. I'm coming to see you, Elizabeth.
Let him sit down. There you go. Water, please.